Yes,
Very
yes,
active
yes.
opponent.
Absolutely.
So Aparna has also joined. Oh,
Yes.
nice.
Hi, Aparna.
Hi,
So lovely
Aparna.
to see you. Aparna to Aparna. So nice to see. Where to begin? So, yeah. So, there's actually, we can also have a series of discussions on this because there is so much of information actually that has been,
There are different
going
aspects to
around
it,
in
right?
the social media. You need this. Now, each vitamin people are talking about and each and everything. There's too much of information which is going into the minds. And, this is something we need to also simplify, given the time. It's just 24 hours we have. So I feel it's very important to actually understand each and every body type and then how it is important to, have this mindful menopause.
I
think
think
we
you
all
got a clue because you understood that Vata, Pitta, and Kapha is different.
very well. Yes. 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 Very
That's
well.
nice. That actually gives us a clue on how people are. Exactly.
Yes. We have Jyoti with us. Hi, Jyoti. I'm so happy you're here.
Hi Aparna, hi Aramya.
Aramya. Hi to actually Reema, Vandana, Supriya, Jodi, Aparna. I can see all of these.
Yeah. Jyoti was there in the earlier programs also. Right,
Okay,
Jyoti?
okay.
Yeah, I've spoken with the doctor a couple of times.
Okay, right. Yeah, true. I remember. I think should we wait for another 5 minutes or something, or should we just begin, or we'll see because there is a live streaming. That is the reason why I've given because record and then put it. It's good that can live stream it. And what do you say? Should we wait for another 5 minutes?
I think it's just 5 minutes, right?
Yeah, perfectly fine.
Who's recording this?
There is one more person. That person from UK. He's recording and he's live streaming it for me.
Okay.
So kind.
Different connects.
Yes. Okay. Meanwhile, I can, if Aramya is here.
Yeah.
Okay.
Yeah. I'm good to go.
Before we could begin, I'm just asking this question. Is there any muscle degeneration? The term muscle degeneration.
Yeah, of course.
Usually happens in menopause time?
Many people know actually menopause, it is actually osteoporosis that happens mostly. Muscle degeneration is very rare.
Okay.
Because our muscle power is much more better, stronger than the bones. The bones actually get weaker when the estrogen is getting down.
Okay.
That
Achha.
actually happens to many people.
Okay.
There is an acute osteoporosis. Actually, I was about to talk. I have put that. Actually, one of my important points.
Okay. In fact, I was with the PMR department and they have told me that it is a muscle. We were talking about muscle degeneration and also I think, I'm not very sure, is it cell degeneration, muscle degeneration?
See, actually, muscle degeneration can happen, but muscle degeneration doesn't require this menopause to come in.
Uh-huh.
It can happen
Okay.
at any point of time when you have the Vata Pitta on the high.
Okay.
If it is
Acha.
going on the high
So it's
spikes,
nothing to do with the menopause.
no, it's not good.
Okay.
See, when menopause comes in, the same dosha pattern actually happens.
Ah,
So that when it is actually combining together with the combination of the disease, it just spikes up during that
okay.
period. That's all.
Okay. Can stress also related to the muscle degeneration?
Sure, sure.
It should. Okay.
You actually can have weakness of the muscle. It is not necessary that anyone can have muscle degeneration because that's a very I should say it's a very deeper
Oh,
word.
acha. Okay. That is more of serious.
Yes, it's a more
Okay.
complicated, a serious word. I would
Okay.
say many people experience myalgias.
Huh.
And
Five.
fibromyalgia is a very common word that we can address when you have menopause.
Okay. So I think mostly women do experience this fibromyalgia.
Yes,
Yeah.
yes.
Okay. All right.
I have seen men also. I have a paper actually almost
Uh-huh.
completed on fibromyalgia on a man. It's about a 18-year-old boy
Okay.
who actually
Fibromyalgia.
had fibromyalgia.
And what are the causes, like, the things like,
A
is it,
silent depression.
ah,
Silent
exactly. I
depression.
was
Actually, that is
thinking.
the worst cause. Actually, we see in
Yes.
many places, and then it actually shows up. It started showing up as an evident myalgia condition, but
Ah,
I should say that Ayurveda, with 13 days of treatment, we were able to prove much better with other types of medicines. No? Like many,
oh,
even allopathy people, they were not able to. Actually, even just a painkiller also did not help. But with Ayurvedic
okay.
treatments, the interventions, we were able to actually relieve much more better.
Wow, amazing. Yeah, this is like,
That's why we wanted to make it as a paper, and we have actually even
do.
a psychotherapist was also there along with us who worked
Okay.
on the patient. So
Okay.
she is also part of the paper.
Once you finish your paper, do let me know, because this is very, very important. These days, silent depression within the age of 23 and 24 is causing all of this. I have a patient with the same similar conditions.
I understand.
Yeah.
It's truly, actually speaking, it's a very tedious process also because to
I'm sure.
convince a patient to undergo the treatment,
Yes, yes.
it's really
Absolutely.
hard.
You
And
know, whenever
I
I
should say,
talk to
once
you,
they are in, they will understand the difference.
yeah. Whenever I talk to you, I always feel I should come there and get completely rejuvenated and then come back to
Most
work.
welcome to OJS.
Thank you
I
so
can now
much.
open hands.
Thank you. I will, for sure. This 2025, I must. I'm going to send my daughter also to you. First
You do.
hand experience.
That's
Yeah.
nice.
So, we'll have the question answer session at the last. If anyone has
Hmm.
questions, we'll quickly
I
finish
think
them.
we can start, right? Let's
We
not keep it late.
Yeah. Okay. All right. So I'm going to talk about this, little association with you. I think from 2020 onwards, we had this working kind of a situation. I mean, before that, we knew and we were working on something different. That was psychometrics, constructing psychometrics. And after that, we began our journey in this YouTube or channel through Anantam. I'm very happy I'm still associated with you and I can able to see your OJS all the time. So I'm going to talk about Dr. Aramya as a highly respected Ayurvedic physician known for her very compassionate, I would add, and deep-rooted expertise in holistic healing. As the chief physician at OJS Ayurvedic Clinic, she leads a dedicated committed to restoring health and wellness through classical Ayurvedic principles. With 18 years of clinical experience, Dr. Aramya has built a strong reputation for successfully treating a wide range of chronic and lifestyle disorders, particularly those affecting women's health. She also serves as a consultant at the AVP Research Foundation, contributing to the advancement of evidence based Ayurvedic practices. Her involvement in clinical research and integrative medicine has earned her recognition among peers and patients alike. In addition, Dr. Aramya holds the position of senior consultant at Nilai Wellness, where she extends her services to a broader community, offering personalized wellness plans and that combine traditional wisdom and modern insights. Dr. Aramya's calm demeanor, patient centric approach, and unwavering dedication make her a trusted healer in the field of Ayurveda. Her work not only exemplifies the therapeutic power of Ayurveda but also inspires a new generation of practitioners committed to natural and holistic healthcare. I really welcome you on board today, and we are going to have a real good time. We are going to really learn a lot of things about our body. I welcome you, Aramya. Over to you now.
Thank you, Aparna, for this beautiful introduction. And I should say thank you for accepting that it's very important that
Yes.
I accept the other disciplines as well, because this has actually learned, I've been earning that every time I never want treatment alone to be an aspect for Ayurveda. I've always earned that preventive aspect should be well learned, well mentioned, and lived also. So every time I have a presentation, I make sure that something there is there for people to carry on, so that they actually change
Yes.
that small things at home, which can actually give them a better lifestyle and to a better health, which can reduce the problems and increase their happiness. Okay, so moving
Absolutely.
on to the topic. Thank you. Just sharing my screen.
Yes.
Hope it's visible. Is
Yes.
it clear?
Yes, it's clear.
Okay. So today's topic is actually the mindful menopause. The literally when I was discussing with Aparna, we came across this topic, and speaking in this scenario, there has been so much of discussions on menopause. But what literally lacks in every household or every person, especially even if they are very well literate and all, what literally lacks is that mindfulness or that understanding of what literally happens. They are not completely aware of what happens and why it happens. So what happens is that they literally undergo a shattered feel when they undergo this menopause. Actually, menopause is nothing but it is just a cessation of the menstruation. There has to be a variation in our life, and as the stages of life takes us, that variation has to be well dealt. Whenever we are not dealing it in the right way only, it leads to diseases. Apart from that, it is just a phase and it's just a period. Now, every time I start with this slide, because are we always asking this question? Are we really maintaining our health? Or we trying to actually just evade from diseases? So, why this is important is that every time you have a problem, there should be an approach where you should know when to meet a doctor also. Now, why I say this is because I will just explain to you about a friend of mine who actually was recently diagnosed with perimenopause. Perimenopause is a stage wherein you are experiencing just the different variations or mood swings when you undergo a menopause just few years before the menopause itself. But actually every time we meet, we were discussing about menopause. But what literally happened is that we are not literally discussing on what should be meant. And so in this slides, we will be actually seeing what you should do when you have a problem and when you should meet a doctor. This is very important, and let's take it seriously. So Ayurveda has actually always dealt in two different ways, that the health is actually considered a very prime importance, and healthy people have been always considered prime also, wherein healthy people, if just to maintain their health also, it is possible with Ayurveda. But at the same time, when in this present scenario we have many diseases and illness also to be treated. So it is two phases of Ayurveda that we see, in which one is swasthya rakshana, that is, you are just maintaining the health of the people who are trying to keep their health. That includes proper sleep, proper attitude of diet, and healthy habits like exercise, all of these. Okay. And at the same time, we have a set of people who don't do any of these, who don't at all heed to any of the doctor's advice also, so end up in a disease condition. So these people will be actually treated. So swasthya rakshanam adarasya vikaranut, we actually treat the diseased also. This is about the two phases of Ayurveda. So Ayurveda has always given importance to wellness and preventive aspect rather than treating the disease. So in my slides I will actually be mentioning about a preventive aspect also, what is possible. Womanhood is actually being celebrated in Ayurveda in many ways. But if you look into, every person undergoes these stages of life. So, Vata, Pitta, and Kapha are three humors. We would say like these are the functional units. So, basically, to understand, I would say Vata is it's like a purposes. Pitta to balance out our emotions, like basically, I would say our temperament balance. Like you can correlate with Agni, and then Kapha, which you can actually relate it to a stable position. So you're something which you connect anything to stability or growth. All that actually can be connected with Kapha. Now, the stages of life include Kapha being dominant at some ages, and Pitta being dominant in some ages, and Vata being dominant. So now Kapha is actually the stage which is very dominant in the beginning stage of just after a baby is born until the age of 16 years. We call it as the Bala period. That period is actually very much dominant in Kapha, because that is a period when a person is actually growing and you need the stability of nutrition, everything in a better quality. So that actually happens with the view with the Kapha in a nice nurturing way, and it is actually helping the person to grow in a beautiful manner and undergo a process of adulthood. When they're actually entering that adolescence, there finishes the period of Kapha. And then when the female is attending the menarche, then starts the attachment of Pitta accumulation. So the Pitta dosha then starts in combination with Kapha, and slowly the Kapha weans away. Now the Pitta is dominant until an age group of 40 years, 40 to even I would say until 50 years also, the Pitta is dominant. But the range goes like the Kapha Pitta will be dominant in 16 years of age, and then from 20 years to 40 years it will be Pitta that is dominant, and then after 40 years slowly the Vata will also get accumulation with Pitta. And now what is Pitta here, why it is important? Because when a person attains the menarche, the menstruation starts. The first day of menstruation is actually called as menarche. And when that menstruation starts, the hormonal variation also starts. That hormonal variations is highly connected with Pitta. Now, when they have a normal Pitta balance, they will have a normal menstruation for the specific days with normal flow, not an overflow or not a less flow like that. It will be actually perfectly fine. They will not have much complications like vomiting sensation, any type of PMS conditions will not be there. So they will have a balanced menstruation all through the years, and their reproductive age is also the same. So this age until the 40 years is a reproductive age. And slowly when the person attains the 40 years, 40 to 50 is a period when it is Pitta and Vata in accumulation, wherein they will start having the perimenopause symptoms. So when slowly the perimenopause symptoms happen, That is the period when the person will slowly move towards the menopause. And during this phase, each person will vary differently. It is not that everyone will have problems. It varies, completely varies. And each person is individual, and each individual shows up different signs and symptoms. For one person it will be just a physical one, for one person it will be just a mental one, like a psychological one. It is not necessary that you have the same pattern. You might be thick close friends, you might be even sisters, but you will not have a same pattern. Make sure that is the same. Please understand that that is the way it has to be. And the influences, the during the stage of life, whatever is going to influence this pattern is actually the food, lifestyle, and mental health. Okay, so this has to be in unison with whatever we are doing during this period. Now, stages of menopause. To understand the stages of menopause, if you look into, as I was mentioning, from the age of 30, I was actually mentioning from the age of 40. From 30 itself, there is a pre-menopause age. So, when the pre-menopause age sets in, then it is actually that the slowly they it is actually the fertile period wherein they will have a proper menstrual cycle, and it is also important that the fertility is also maintained. And then when the perimenopause age starts from 40 years to 50 years, they undergo the variation of menstruation. That variation of menstruation is what is happening because of the hormonal variations. Now the hormonal variations, hello,
Yeah, slides. I need slides.
you are able to see it?
No, this it's only the first slide which is there.
Oh, okay.
The
I'll
slides
just
of menopause.
share again.
Yeah, sure.
Oh, you not see the all this share is slides. 1 minute. Huh?
No,
I'll just share again. I'm sorry, I'm not.
no, it's okay.
This is okay now. You're able to see, Aparna.
Yes, Aramya, able to see
But
now.
it has not gone to the slideshow. No?
It's not gone.
1 minute. I think I have to do it again. Did you see this? The slide?
Yeah, we can see this.
Okay, the stages of life.
Yes.
Okay, should do I need to explain it again?
No, not really. I mean, if anyone wants to. We're talking
Okay,
about the stages of menopause, and the slide is also the same.
okay,
All right.
right. Now I was actually talking about this perimenopause, wherein you will actually see that it is about 40 to 50 years, wherein the stage is actually reaching with a combination of both Vata and Pitta. So when Vata and Pitta comes in combination, there starts this irregular menstruation, and there can be very slight variations of some symptoms also which shows up. And in the post menopause phase, you will completely have the abstinence of the menstruation, and you will actually go to the menopause, literal menopause stage. It can actually vary from 50 to even 55. Until 55 also you can have the perimenopause phase. It is not sure that always it should be 51. It can go until 50 40 to 55 years of age. And post that, when you don't have menstruation, it is a stage of menopause. And in just information that anytime when you have this menopause, After 1 year, if you have any kind of bleeding or any type of menstruation happening, you should immediately intimate your gynecologist. Okay. Now, actually speaking in Ayurveda, there has been specific disciplines for females during menstruation. When a person actually attains the menarche, it is called as Rajaswala. Okay, Rajaswala. And during pregnancy, it is the Garbhini Charya. And during the postnatal period, Sutika Charya. And then it is actually the Rejo Nivritti state. Rejo Nivritti means there is a menopause state also. Okay. When it is menstruation, you will have a menstrual cycle which actually ranges from 3 to 7 days with a gap of 28 to 30 days. And the menstruation variation or the PMS that can occur includes headaches and any type of psychological variations like anxiety, mood swings, anger, stress, etc. There can be increased or normal bleeding or excess bleeding, painful menstruation, irregular menstrual cycle, the low back pain, and other symptoms. Like these are actually diseases which you should intimate to a physician. When you have a normal menstrual cycle, there can be color variation also, but if it is going very dry, very scanty, very thin, these are all things that should be mentioned, because there can be once in if you have in a year one cycle and all, it can actually show variations, because it based on the climate conditions or based on the diet proportions during that period. You can have variations, but that doesn't mean that it should stay for every cycle. So watch your cycle from time to time, understand that if there is a variation, it has to be intimated. And literally speaking, during this period, the balance of doshas is very important. Ayurveda has always advised a kind of mediocre food, like not very spicy, not very bland also, not very spicy also, not very oily, a kind of food which is very sattvic, which is comfortable for the mind and the body, which is able to maintain the digestive fire. Intake of ghee during this period is good. Apart from that, the buttermilk, kanji type of materials will actually balance the doshas, like that. Okay, so this is about the menstruation. The importance of pregnancy care goes that the pregnancy, like whatever every month you have to follow as a prescription or as a dietary regimen is also mentioned in Ayurveda, that helps in the fetal growth, the mental status, and the physical status of the mother, and the development needs of a fetus. It also eases the mother and prepares the mother for the labor. It helps in giving that support, like you need the pelvic support, you need the perineum to be supported. So whatever medicines that is being advised month to month, it actually caters to the needs of the mother in every month of the pregnancy period also. We have seen that actually I have patients who actually undergo these type of medications every month, so month to month. Why it is important is that when they are taking these medicines, it is not only for the baby, it actually improves the vital status of the mother as well, which helps in improving the quality, or you're improving the physical strength and the mental strength of the mother, wherein the mother becomes really strong and vital when she is actually undergoing the labor. And post the labor also, in postnatal care, which actually deals like 1.5 months to 6 months is what is actually the postnatal care is advised as per Ayurveda. Now this is also very important during the process of post delivery, because the mother actually nowadays, especially in this present scenario, the mother actually loses that control, or the self confidence is actually depleted once she is undergoing that delivery, and post that she is not able to cope up with the different stress levels and variation. So there's so much of postpartum depression that's happening, variation with the body, the myalgias and all, she's not able to maintain, which actually stays on until menopause, which becomes like a trauma which she carries until menopause, which becomes some of the main problems which is triggered during the menopause also. So it is very important that the postnatal care is dealt in the right way. So what happens when we do the proper care with Ayurveda is that she regains her lost vitality. That vitality means it is the ojas. Ojas literally means our immune strength or our vital strength or the immune. It is like an endurance to manage anything that has happened, and the body itself will be completely changed, and she gets back to her normalcy. So this 6 months will be like with internal medicines will be there, external treatments will be there, which all are helping her to get back to her balance, and the medicines which are actually very much rejuvenative will also be given. So that actually takes care of the postnatal care. Now coming to the rejuvenative. Now what why it is important is that this menopause is a phase. Now this phase actually starts almost by 35 itself. Above 30 itself a person start having the menopausal variation, and by 40 it actually goes to the peak, and by 50 or 55 when the complete cessation of the menopause starts, or there's a complete cessation of the menstruation stops only, they completely come out of the symptoms. Okay, and for few, even after stoppage of menstruation also, the menopausal variation can continue. So it actually shows up in different, for one it is a fear, for one it is hot flushes, excessive sweating, sleeplessness, headache, tiredness, mental stress, palpitation, mood swings. See, actually I've listed down some of these, but it is not a thing that everyone should have any of these. So it can be that you don't have any of these symptoms also, you can be perfectly normal. But if at all you have this variation, you should be aware, you should know that this is a problem which happens on this period, and it has to be dealt in the right way. Understanding where you should intervene is very important in this scenario. Generally when we say vata, pitta and kapha, there is actually that each of our body has a dominance of vata, pitta and kapha also. When you say that all the doshas are there in the body also, I might have an importance or a dominance of vata, or a dominance of pitta, or a dominance of kapha. Literally speaking, when you have this dominance, the vata and pitta is a common factor that happens to every female. But when it comes in association with the dominance of the physical body, like if at all a person is a vata dominant person, then the vata pitta combination, when it comes to a vata dominant person, the person will have symptoms like dryness, anxiety, insomnia, joint pains, the joint degeneration, like that conditions. But at the same time, when the person is actually having a pitta involvement, if it is like a person with very dominant pitta, then she might experience hot flushes. Hot flushes are like a gush of heat sensation that you might feel. You sweat out a lot, and then you might even end up with a giddiness. Okay, that is actually the hot flushes, and it is a very common symptom that we actually see when there is pitta involvement. Irritability and mood swings, the mood variations, it is a very common factor that we see when the person is having a pitta involvement. Now the same vata pitta dominance along with a kapha balance imbalanced person, it leads to lethargy. The lethargy means I just don't want to do anything. That is the statement that they will actually put forward. And depression is a state wherein they are trying to actually move internally towards themselves. They just don't want to actually meet anyone. That is the way they will go into. And weight gain is a very dominant factor during this period. So literally speaking, actually when I say this, I should also be saying this, that exercise is one important thing which we will be actually looking into the preventive aspect also. But exercise is one thing which will help you to create a balance in all of these spaces also. Okay, there are some silent signs. Now these are the dosha impacting this signs is very common, and we see actually people discuss about this. But these are some signs which people don't look into in a deeper manner. Um, can I
Slides.
continue, Aparna?
Yeah, slides. The
Slides.
slides are
Okay.
not moving on their own, I guess. You have to manually do it.
Okay, I'm actually moving it, but
Okay.
1 minute. Now,
Now we can't see any slide.
1 minute, 1 minute. How is it that happening?
Yeah, how dosha impacts the body. We have come there.
Oh, now you get it?
Yes.
Oh,
Yes.
I'm not actually going. It is not going to the next slide now.
It's not going, maybe, manually. It's gone.
No, no, actually, I stopped because I was not able to actually move. Again, it is showing the same way. I think it is pinged now. No, the slide is not just moving to the next one. 1 minute. No?
Right.
So I'm sorry for this, but it is just troubling.
It just happens.
Yeah. Oh my God. Now is it correct?
Yeah, it's dosha impacts the body.
Yes, yes.
Yeah.
You, if at all you're not able to see the slide, no, just immediately tell, okay?
Yeah, sure.
I'll tell that I'm going to the next slide so that we don't miss out on the slide.
True. Take it.
Okay. So
Yeah.
here, actually, in this slide, I was mentioning about how Vata dominant, Pitta dominant, and Kapha dominant people will be actually having the symptoms when the Vata Pitta combination person with a Vata dominant person dominant actually happens, then they will have this dryness, anxiety, insomnia, and joint pain. The dryness is actually linked with much of this vaginal dryness. Okay, anxiety, insomnia, and joint pain can also be associated. In the same Vata Pitta dosha, in a Pitta involved person, it will actually show up as hot flushes. Hot flushes is actually the kind of full sweating tendency, wherein it can end up even in dizziness. Okay, and irritability and mood swings are very dominant. And kapha imbalance, it will actually, if a person is of a kapha imbalance, then they might have a tendency for weight gain. They'll be very tired and they'll be very lazy to do things. That is actually that because it is not that they are lazy, it is actually the hormonal variation that is creating that letharginess. And depression is one very important thing that will actually happen during the period. I've gone to the next slide. Silent signs.
It's not coming.
Okay.
Yeah.
Now it's showing.
Yes.
I think then we will actually go into. Okay, I'll put it like this, and it's not a problem, no?
No, 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 no. That's okay. Fine. As long as we
Okay,
get.
then I'll put it like this. Okay. Okay. So
Hmm.
in the silent signs, it is like these are very very subtle things, but people actually don't notice it, and it is noticed only when it reaches to a point wherein it ends up as a big disease. Especially the first thing that actually happens in a person when you have variation of vata and pitta is you will have difficulty with digestion and overall nutrition. The vata pitta, it will actually agitate the digestion pattern and it will create a variation. Sometimes you will feel hungry, sometimes you are not at all hungry, you don't want to take anything. And when that variation actually stays, there is actually speaking, they will have a variation of the digestion and absorption also, and that variation will completely affect the overall nutrition because in ayurveda we have a term called ama, and when that ama is actually a state wherein you have a toxin that is developed in the body regularly on a regular basis. So when that ama is actually formed, that affects the proper conversion of the food into the tissue development, and that actually affects the overall nutrition also. So when the overall nutrition is affected, there is a deprivement of the actual quality of the tissues, wherein if you want to actually exercise also, you will not be able to, because you are very tired, because your muscles have not received the actual nutrition it has to receive. So that variation of nutrition will also create immediate results, and immediate means it was like within 6 months also it can create that variance. So whenever you experience a difficulty in digestion, which can actually be like you have a regular belching, you have a burping, you have actually a kind of gastric irritation, it can be a sore belching, constipation, loose bowels, any of these are actually variants with the digestion. And this has to be dealt in the first phase, because in Ayurveda, we give a very important prime factor of Agni. And literally speaking, everyone will accept with me, because there is a gut brain factor, wherein if you have a happy gut, you are literally happy mentally also. Okay. Next comes the trouble sleep, increased palpitation. When the vata actually aggravates, when the vata starts getting aggravated along with the pitta, the first factor that is very much dominant is insomnia. The person will find it very difficult to get to sleep. So when they get to sleep, also they will have sleep pattern vary. That is, for the first 2 hours they might sleep, and then for 2 to 3 hours they will not get sleep, and then again after 2 to 3 hours they will be able to sleep back. So in the early morning they will wake up very tired. So that is actually the trouble sleep. That is, the rhythm of the sleep is lost. And that rhythm of the sleep, when it is lost on a daily basis, you actually start experiencing what is called as the variance of the insomnia. It actually tends to become a disease. You will lose the quality of your complete, that is both the physical and the mental you gets varied. It can itself slowly release many kind of toxins, and it even result in heart diseases in an extreme case. You will start getting increased palpitation because of the weakness. You feeling that tiredness, because of that itself you might feel that palpitation, and in extreme cases it will end up in a heart disease. Then comes the dryness of the vagina. See, dryness of the vagina is very dominant in the menopausal phase. In the menopausal phase, when the vata is very dominant than the pitta and kapha, then it undergoes the dryness. The dryness actually shows up that you might have itching, you might have an irritation, and you might even end up scratching and creating lacerations. So these should be maintained, that you should be using some moisturizer. The usage of the ghee, sesame oil, olive oil, all of these actually help in improving the quality of the vagina. Actually, speaking, sesame oil is considered the best, because it is mentioned itself that it improves the quality of the vaginal flora also. Okay, so that can be maintained. Osteoporosis is yet another silent sign. If you see this osteoporosis, actually speaking, when the vata is very dominant along with the pitta, just immediately after the person the cessation of the menstruation, you can see that the person starts developing a knee pain or an immediate back pain. That is all associated with the low quality of the bone, and immediate withdrawal of the estrogen is prominently showing up this osteoporotic changes in the person. And this osteoporosis, we have seen that it can be acute or chronic also. In acute condition, it can end up in different types of fracture. So you should always be careful in a menopause situation that you are taking enough quantity of calcium and vitamin D3 supplements also. It includes a usage of normal seeds like tilla seed, sesame seeds, peanuts, and different types of nuts. These are actually very good sources which helps in improving the calcium build. Moringa leaves are very good as a calcium builder for people who are not able to take milk. We've seen that milk is also a very good portion which can improve the calcium buildup. So try to include the milk and ghee as much which is possible during this phase, so that you will be able to balance the problem. At the same time, you are supporting it with the right nutrition. Okay, and then comes the trouble with the memory and concentration. This is a period wherein you have the confusions. So what happens is that when you have this vata pitta on the rise, you have variations of your thought process that also affects both your memory and concentration. You're not able to actually look into one material for a quite longer period of time. So how you improve that is that by small things like art therapy. It is like an art therapy which actually helps you to keep yourself attached to a thing, or pranayama type of techniques which will actually improve the quality of your concentration. Now why I say the silent signs are very important is that I've actually taken note of these because these are the very common things that we see at a clinic. And then on an OP basis, these things, these two slides, what we have discussed now, are very common. But the problem is people don't understand that it is part of the menopause. So please understand that it is a part. You actually please inform your, when you talk to your friends, because we have some few people now. So when you talk to your friends, when you talk to your loved ones, you please engage in such conversations also which involve around these, because the awareness is what is actually lacking now. And this awareness, when it goes to the right people, it will actually help us to ward off the problems that could be arising because of non-understanding. Understanding a problem and taking care of that is very easy, rather than not understanding where are they standing at all. Okay, now what are the things that we can actually do to help in Ayurveda in the preventive aspect? So the first one I would say is the rules of taking food. As I was telling you, Agni is a very important factor for us. Just like Agni in the Homa is very important for us. In Ayurveda, any person that you go, any physician that you go and meet, they will first ask you about how your appetite is, how your bowel movement is, because these are very much connected. How your appetite and how your digestion is varies very much, and it actually correlates with your constipation or proper elimination. When the proper elimination is there, please understand that you're doing the best to your body, that you are actually giving the apt nutrition. Only when that apt nutrition is coming, you are properly eliminating also. So the right food at the right time, the right quantity. There is no fixed proportions at all. Actually speaking, or how much ever the nutrition say also, every individual is an individual. Please take you as a prime concern and take the right food that is very much effective for you. Because, for example, if I say kanji itself, just kanji is like rice and water, but that itself is not very much fine with for many people. For people who are actually comfortable with wheat, they can go with wheat. So it is not that you should be taking only rice. So please understand which food is right for me. You can take the help of an Ayurvedic physician to understand which is actually right. Okay, if you are a very pitta person, then rice is actually good for you. If you are a vata and kapha person, then it is actually wheat, barley, that is all good for you. So okay, you can take like that. And then no processed food. When I say no processed food, any type of processing material which you get from the grocery, always see the material. And then see, I actually wantedly put the picture for this purpose, that you are able to see what is there. Now when we get a spice product also, people, what happens is that they actually end up in gastritis type of conditions, because the chili powder that they use is too very spicy, and it actually ends up in different combinations which is not conducive to their health or the status of their environment. So what happens is that variance is creating the variance of the gut itself, which can ultimately create problems rather than creating health. So avoid any type of processed food. Make your own powders if you want to, and use it at the right time. The right time means the food should always be taken at the right time when your agni is fine. The right time doesn't mean that you can take it any time. Okay, my hunger has come only at 12 o'clock, I can take that. No, it actually means that you have not tamed your body. When you're taking food at irregular timings, you are actually creating a space for that vata and pitta to aggravate again. So during this period, keep yourself as a prime person and make the right quantity of food. Take enough ghee, milk, the spices in right conditions, like not too very spicy, in little quantities. See the usage of garlic, the usage of cinnamon. During this period, the usage of the ajamoda, we call it ajamoda. These are all ajamoda is actually it's not cumin seed, it is I'm not really sure of ajamoda, what's the common word, common term. It's called ajamoda. Ajamoda is a medicine that is very useful in fertility condition, and it helps in maintaining the dosha levels also. So that is why ajamoda is advised better. So these are some of the medicines that we use at home itself on a regular basis. As boiling water you can take. You can take it in the as part of the food. You can take as part of the khichdi also. Use ginger, garlic, all in limited quantity, so that that is also spice. If you are using in too much quantity, that is also going to create problems. The quantity of food and personal considerations should be typically customized. Okay, then this is a very important point, I should say, especially during menopause. See, during menopause you can have variations with your urination, toileting and all that. So in all these conditions, please do not suppress your natural urges, because these urges are mostly involuntary. When you say hunger, thirst, belching, yawning, sneeze, vomit, flatters, urine, stools, all of these are involuntary, sorry, voluntary. At the same time, some are involuntary, but all of these actually work on your nerve levels. So make sure that the nerve is not being damaged in any way. Whenever you are trying to constrict the nerve urges, that the urges actually have to normally pass. When you're constricting them, you're creating more problems rather than health. Okay. Next is actually the Dinacharya and Rithucharya, which Ayurveda has mentioned. Dinacharya is a daily routine in which some things are like mentioned, like using 2 drops of nasal drops, oil as nasal drops, which improve the quality of your menstruation itself during your menstrual period, and post that also it helps in calming you down. So, in the such type of cleansing techniques are there, which is actually mentioned as part of Dinacharya. It helps in improving the sensory organ function, and it also rejuvenates the body when you're doing on a daily basis. Because excuse me, that also involves the Dinacharya also involves daily exercises, oil application. See, the daily exercises will help you in improving the quality of your bones, your muscle power. Because when you have this menopause, the muscle power is something that actually will start weaning off, and it has to be improved by the usage of even they say actually you should be going for weight training. But if you are not even just doing walking, you should start walking and rejuvenating the body by the usage of oils that is possible. Now, when you're doing this Ritucharya, it's a tendency wherein you have a seasonal variation and you try to fit in the maximum materials which can balance your lifestyle with the balancing variation in nature. Because every time you have a rains, every time you have a very cold climate, the bodily
Ramya,
variations are also
Ar-
happening.
Aramya, sorry to interrupt.
Yeah, yeah.
This is because getting managed by somewhere else. We have five
Okay.
minutes to wind up. In case if this ends, I'm not sure if this ends because I'm not managing
Okay.
this. And we will
Okay.
join in for the question answers again with the same link.
Okay, okay, fine.
For now, I don't know if this is going to disconnect, but we'll let us keep it with that time,
Okay,
within 5
okay, okay.
minutes.
Yeah,
Yeah.
I just have one more slide
Yes.
only. It's very
Yes.
important.
Yes. Yes.
Okay,
That's true.
so with
Yeah.
this Ridhucharya, we are actually advising that the usage of specific condiments or specific lifestyle changes based on the climate, which will help in improving the quality of your health itself, and seasonal purification. Like in specific month, the enema is advised to be done so that the vata is kept in condition. And in specific month, like we call it Grishma, in which actually the pitta has to be undergone, like the purgation is advised, which helps in controlling the pitta level, like that. Okay, and next comes actually, this slide is one of the best slides, I would say, which shows what can be done in case of a menopause. When you are attaining the menopause, the internal medication actually can be started with the help of a physician, like one or two medicines which helps in balancing the dosha level and improving the rejuvenative side of your body itself. And along with that, these are some of the treatments which can help in improving the quality of your the vata, pitta and kapha. When it has to actually be in a balance, this treatments will help you. The shirodhara will help you in calming down psychologically very well. It's a stream of oil or any liquid that is actually passed all over the forehead. And abhyanga is actually the oil massage. It's a it's more than a touch therapy. And padabhyanga is actually the oil application all over the feet, along with gentle massage, which is a vigorous rub, which actually ends up that the massage and all, which is actually done with the lower the feet, it improves the eyesight and it improves the overall being itself. Now these treatments are advised as, especially if you have this variations causing diseases, or if you don't have much of a problem, you can just go with internal medication itself. Now, this is a sign wherein yoga is one of the best ways to connect with the physical and the mental you. Stay connected, stay in unison. That is very important, and stay in present. And this is possible with the help of yoga, or stick on to any exercises. But you need that exercise to tone you up mentally, physically, and it is going to actually help you in being into a spiritual mode also. Because when the body and mind is in unison, your mind is also talking to you in the right clear way. The other one that I would advise is that you have to go for a breathing pranayama, which actually will help you in improving the quality of your oxygen uptake. It also improves the quality of your concentration, deep meditation process, and deep thinking process. It gives you clarity on what you are doing, and that sensation of a deeper thought process, or a clarity on a longer stand on one specific thing, that actually will help you to improve the overall well-being itself. Okay, and thank you for this patient hearing. I am now open to actually questions.
I think we can take questions because there is
Yes.
no such time that it is showing on my laptop or the person's
Okay.
laptop. We can take some questions.
Yes,
And
please.
after that, even I do have a lot of questions. It's all collected from patients and also myself.
Okay.
So I'm going to share it at the last.
Okay. Shall I stop sharing?
Yeah, not a problem.
Okay. Yes. I'm all yours for question now. Shoot.
Yes. Who's asking a question? So I think I'll begin with the question then, in that case. Okay, this ama we were talking about, and how to generally get rid of this ama on a regular basis. because the built
Okay.
up is natural, the kind of life that we are living in, and the kind of stress we are exposed to. I think the ama built up is also in the mind and also in the body. So how to get rid of this? Is there any kind of routine that we can follow in simple ways?
Actually, I would say moderation. That's the right word.
Okay.
See, every time we are doing overdoing things or underdoing things. Just for example, food.
Yeah.
We generally overdo it now. We,
Right.
instead of taking just 2 meals a day, we are doing from 3 to 5 meals a day. So
Absolutely.
what happens is that the body is not able to actually digest it, because every body is now actually it's very supple, and it doesn't have that enough agni to properly digest it and transform it to the right quality. And so what happens is that every day we are giving contributing to that ama. Okay. And
Okay.
the best way to understand your if your body has amas, when you're waking up in the morning, if you're feeling tired, then
Okay.
be sure you are having a small slight symptoms, you're starting of ama. How to get rid of it? Now, how to get rid of it is, you start your day with a warm water, than with a glass of warm water rather than a glass of tea or coffee. It's a better option.
Okay.
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 And instead of tea or coffee also, I would suggest the chukku kapi. The chukku kapi is a combination of coriander,
Mm.
pepper, and the jaggery or palm sugar.
Okay.
Okay.
All
If you
boiled
have
together and take it.
yeah, with dry ginger, that's a very good combination, which is a more alkaline in nature also. It is not very acidic. So we are not trying to create the first thing in the morning itself, we are not trying to create more acidic nature to the body, which
Mm.
actually will help the whole body to sustain in a better way.
Okay.
Okay.
Wonderful.
And the
That's
best way to get rid of armor is exercise.
okay.
I think most of us run away hearing the term exercise, but that's the
Excellent.
best way to keep your body away from mama.
Absolutely. That's just wonderful. I think this is really helpful for a lot of people. And you were also talking about nuts, while in the hormonal imbalance. Can you just put a little more light on it? Because the nuts these days, a lot of people are talking about when there is a hormonal imbalance, say, for example, a thyroid or something. There are several nuts that you're not supposed to take. And there are several nuts. How do we really understand, to understand, okay, if I have a thyroid, I know, I understand that. But in case for someone, if they do have a hormonal imbalance or something like that, how do they understand that these are certain nuts that they can consume or do not consume and they should not
Actually speaking, it is a big chapter. There are so many
consume?
seeds now on the pool. Like I would say, stick on to just very few.
Okay.
Like peanuts. Peanuts are a very good source for iron, for hemoglobin content, even for calcium. It is actually very good. Only that it should be taken in moderation.
Okay.
Especially for people who have allergy, they should not be taken for sure.
Okay.
Gluten allergy, especially if peanuts, then it is hyperallergic for many people. In
Okay.
such case, the best one to stick on to is tea. The
Okay.
sesame seeds are really good, actually speaking, than all the other seeds. This
Hmm.
has got all quantity like of calcium, iron, phosphorus. All of these are available, which will help us in maintaining all the dosha levels also. I'm not
Okay.
just talking about the nutritional level. Our
Right.
dosha level is also balanced when you're taking tila. Okay.
Okay.
That when you're taking, like, you make this till laddu, no, like
Hmm.
in that way you can actually, you can make yourself till laddu with a little bit of addition of dry ginger powder also, which
Okay.
will help in complete absorption also.
Okay. So now,
Jaggery.
per
Yeah.
Ayurveda, also wanted to know about the till laddu that you are speaking. I am living in the north of India. So there is a saying that in the north of India, till laddus should be or must be consumed only in winter season. How true is that? Can we have something like, in moderation once in a while, even during summers?
Actually, when I say till laddu, I mean to say only a small laddu that can be taken. But what happens is that that small laddu will be taken 2 3 days through 2 3 times of the day. I never mentioned that. I
Right.
mentioned like one time a day because we are actually trying to balance the nutrition here
Hmm.
rather than actually giving you a snack.
Correct.
Okay. So, actually speaking, the tiller is actually advised only in moderation just for the idea that it is actually hot in potency. That is why they advise only in winter season. It is very good during the winter season. In summer seasons, if you don't have a bleeding tendency, it is completely okay to have one day.
Okay. All right.
But if you have a bleeding tendency, you are not supposed to take daily.
Bleeding as in during the periods?
Yes, over menstruation. If at all
Over.
they are and in the perimenopausal phase, if you
Okay.
have bleeding, too much bleeding, then you cannot be taking.
Okay. All right. It's
Okay.
also replace the estrogen, right?
Yes, yes. We are actually see that is one of the best ways to replace estrogen.
Correct. Okay. All right. Acha, Aramya, there is also concern about women these days going through a lot of, menstrual issues, especially when I'm talking about this. It is like fibroids, one. Two, we have, something related to
Endometriosis.
endometriosis, of course. These are the issues that, we hear a lot. And even though there is a lot of understanding about menopause, broadly, but a lot of people still in confusion what is suitable for them. There are advertisements which come, which pop up, take magnesium, so it is going to replace everything. There are too many people consuming magnesium just like that. So how good is that, and what we should do to understand why this endometriosis or PCOS for youngsters like even 13, 15, 16 years, these people are going through, what is the condition of all of this?
Actually speaking, see, the reason is still not viable because we have so many reasons. Because starting from food, starting from whatever medicine that you were mentioning about magnesium, intake of magnesium can also create problems.
Yes.
So, so the thing is that, as I was telling you, the moderation is one thing that has to be done. When
Hmm.
you are actually correcting things, you
Hmm.
have to make sure that a person who's in the menstrual phase should have a menstruation. In Ayurveda, that menstruation has been given so much of importance because the menstruation is like a cleansing that is happening for the female on a daily basis. Means
Hmm.
I mean like when I mean daily basis, that hormonal variation is actually creating a hormonal balance only. But what happens is because of our jerky situations nowadays, we understand that is all imbalance.
Hmm. Okay.
Actually, it's a hormonal play, and the hormones are at real play, but we are not ready to accept them. Okay, that is what is happening. So when the hormone levels are actually variant, we have to undergo the correct hormonal therapy as advised by any gynecologist or any ayurvedic physician. Because when we say like sukumaram kashayam helps, saptasaram kashayam helps, these medicines are advised as per these hormonal variation conditioning to the vata pitta and kapha disorder. Okay,
Okay.
and menstruation, when they are having a regular menstruation, means like monthly once with the correct cycle, then I'm sure that they will not have any problem of endometriosis and all. These endometriosis and all happen to people just because they are not heeding to have that regular menstruation happening.
I see.
The
During the
when you have
perimenopause?
yes,
Okay.
yes, when you have a variation of menstruation, you should meet a doctor.
I see. Okay. Okay. So that's the reason, eventually sometime.
Yes, yes,
Okay.
yes.
And what
That
is
is
the
what actually in Ayurveda it is considered as a very normal thing that the complete cleansing of the whole body literally happens when a person undergoes menstruation. I think most of us would have experienced, no? Every time
right?
when you have a menstruation,
Mm.
after the seventh day, we are completely, you are just rejuvenated.
Completely.
That feel should be there,
Mm.
and at the same time you should be ready for the next menstruation also to happen. And I should say that we should be open to that variations of hormone. We are not actually dealing with the the body right way and we cannot complain.
Right. Absolutely true. True that. Aramya, one more question. I don't know if this is related to this, but I have had this case of a child, 15, 16 years old, where in the school they totally emphasized on physical activity, that she needs to participate. And there was a mother and who went to the school and asked for, that she needs rest during the periods because it's very heavy. She has pain and all of that. I also know that there is a long debate about, whether women should rest or to go normal, have their own life. And there are also advertisements which supports like, they are jumping, horse riding and doing a lot of stuff like that. This is a very debatable kind of a thing. So the mother came to me about all this for the situation that she has this kind of, and emotionally she is very low. So what do you really suggest for, do we need a, mental peace, though we cannot search for it, but at least physical rest is required during those times? What do you
Yes,
suggest?
yes. Actually, as per Ayurveda, the mental and physical rest is actually advised. That is why the first 3 days, it is not that full menstruation and all, you don't have to rest, but at least the first 3 days, if you're resting, the proper elimination actually happens. Otherwise, what happens is there can be like every time you're actually going into an activity, we understand that there is an vata aggravation. That's a normal thing. When
Okay.
a person actually goes for a cycling or you actually are into sports too much, there will be a vata aggravation. And
I
that's why
see.
we advise this oil application. For a person who is actually regularly on sports, oil application will balance that dosha.
Okay.
But
Okay.
at the same time, when you are doing on the same period, when you're having in the menstruation also, you are doing the same, oil application will not be enough because
I see.
already there is a vata aggravation. We understand when there is a menstruation, there is a vata aggravation,
Hmm.
and that vata has to be you just have to pacify it. You just have to let it go. And
Okay.
when you're not letting it go in a proper way, you are actually trying to agitate it. And
I see.
that is also one of the reasons why many diseases come over.
For example.
Even I would say like this endometriosis, fibroid variations can also be some of the these are some of the reasons, because you would have seen that 10 years back our parents did not, our that generation did not
Absolutely.
have much of this adenomyosis and endometriosis.
Right.
Now, because there is an because this generation people are working, they have to keep on moving, and there is no time for rest.
Right.
I would say
Absolutely.
at least that first day, if they are able to actually rest up for some time, it is not that they should be completely lying on bed, but that excess movement can be at least reduced.
Reduced. Okay. Okay.
If you plan, like just for example, if you're planning a shopping on that first day, you can actually avoid. So that's something that you can avoid.
Absolutely, we can avoid that always. Yeah, and
Yes,
there is
actually.
also one more thing that you mentioned. After a year of no periods, and suddenly you get on
Yes.
periods, that you should consult a doc. And could you tell me why is that you should? Because a
It
lot
can
of
be
us don't.
actually a sign of carcinoma. It can be a sign. It can be a showing up symptom wherein you can have problems like even endometriosis type of conditions also,
I see.
or any fibroid growth which is left unattended,
I
or
see.
any cancer type of conditions which was actually silent.
Okay, okay. And there is also
So
some people have this a dark bleeding. What do you
hmm,
suggest because of the dark bleeding? And then it turns out here maybe a dark bleeding or something. And after that,
dark bleeding before the cessation of menstruation.
yes, yes.
Dark bleeding actually, the dark color actually
Yeah, yeah.
indicates more vata. You can actually
I see.
take in more ghee, sesame oil, and kind of like comfort yourself with more rejuvenative material like milk regularly. These all will help in pacifying that. How do we
Uh,
avoid hot flushes?
yes, that's this question.
Okay. Hot flushes are actually the very prominent pitta factor. And so try to actually keep your food very light. Include food materials which are actually cooling in nature, but at the same time It should not be like from the fridge. That doesn't, I don't mean that. I mean by quality, the cooling nature should come. Like use of milk is one best example. Ghee is also, it is not actually hot in potency, it is cold in potency. And butter, you can use all type of vegetables, it just cooked steamed vegetables, salads, include more salads in your diet, include more hydration, that is water content, in many forms. It can be in the form of soup, it can be in the form of water. In all of these you will actually be able to maintain better. And one of the best thing is to apply oil here at your vertex. That will also help in pacifying that heat.
Any oil?
Coconut oil.
Coconut oil. Okay.
Generally, coconut oil base is actually cooling in nature.
Okay. All right. Now
Compared to
you.
when you have this hot flushes, it's a pitta. So coconut oil and coconut milk and all is better compared to sesame oil.
Okay. So coconut oil can also be consumed.
Yeah, it can be consumed for sure.
Oh,
Many people take it in
yes.
case of very serious conditions like multiple sclerosis and all. Nowadays, people take that as a very serious medication.
Okay. Oh, I see. Okay. Coming to the oil, I remember that you mentioned about applying oil while we have this dry vagina. So, is it good while applying at the night?
Yeah, you can actually do that. You can, what you can do is you can take a nice sterilized piece of cotton, dip it in oil, and you can keep it at the vaginal end.
Oh,
Actually, it needs to stay there for only 48 hours. Kala, we say that itself is enough. If you're okay with it, you can actually remove that cotton plug after that 40 minutes and just allow that oiliness to stay.
okay. So, it's only sesame oil that you recommend highly, but not
Yes,
the
yes.
coconut oil here in
No,
this
no,
case.
no, no.
Okay.
Absolutely no. Only
Oh,
sesame oil.
I see. Okay. All right. And do we have any more questions here? I think I possibly have covered a lot of things, but I don't know if
Yes,
still
it's
people.
nice.
Yes,
Oh, we good had good interaction we had, not right?
Ye- yes. If anybody have questions about it, then whether we have a hormonal imbalance like thyroid or any other hormonal diabetic or something like that, everyone go through very similar kind of menopause symptoms, right? And you mentioned the very different, vata dominance, pitta dominance, all of that. What if someone has experienced one or two from all of this, pitta, kapha, vata?
See, actually, that can be because all of us are not just one dosha predominant.
Huh.
I only told you for an idea
Yeah,
that
yeah,
it
okay.
will be predominant. Most
But
of us
someone
will be
can
like
have
vata
all of
pitta.
that.
Yes,
Oh,
yes.
okay.
Vata pitta, pitta kapha. Most of us are actually two dosha predominant.
Okay, I think I do have that.
Very, very rarely only you find three doshas in same. Very rare. You can actually
Yes.
find only the sages. And then Vata dominant, Pitta dominant, and Kapha dominant also is very rare.
Okay.
You will mostly see two doshas dominant only.
Okay. So, what do you suggest? Once our menopause, we are done with the periods, how do we carry on? Like, suddenly there is a lot of change, and there is something like, people experience a very different something in their body and they're free. Something like, I don't know. People have experienced it and they have told, we feel very different. So, how to carry on? Like, for so many years, for 30 plus years or something that we had every month experience in some 7 days. So, how should we carry on?
Actually, the first thing, it's a very good question, I should say, Aparna, because this is a very important question at this era. The
Right.
first thing is try to forget all your fears,
Okay.
embrace yourself.
Hmm.
Okay, that's a very, very prominent one, I should say. Start realizing that I am me. You're not going to change even after you menopause.
Hmm.
You're going to change. Your body is going to change, but that doesn't mean that you are going to change.
Yeah.
So if you are strong mentally, you are not going to have much of the fluctuations that you are probably going to have. That
Hmm.
experience is much more likely that you will be able to take it in a balanced mode.
Hmm.
When
So
you are
that's
not balanced,
hmm,
that fluctuation will be varied.
variant. I think it's very important. What you said is that you need to really embrace yourself. That is the catch. That
Yes.
catch.
I really say that you should be self appreciating. You
Hmm.
should have that confidence to take. See, a person once they cross 40, they have actually taken life in a very serious mode. Like they have seen all the ups and downs, and after
Absolutely.
40, this variance is actually a thing that is very normal. Only that awareness should be there, and once they are aware, they should do some things like sitting in peace at some point of time for themselves, at least 5 minutes a day, making a self care routine. That is, like I was telling you, the oil application. Who is sitting and doing that? So that needs to be prioritized. Yes, you might be doing for your child, but not for yourself.
Right.
So prioritize that. And third is, start learning new things. I would say we are not actually engaged psychologically because we stop learning at some point. Start
Mm.
learning. It
Right.
can be just gardening, it can be just coloring a book.
Yeah.
Keep engaging, at the same time learning also new things, which actually will keep us motivated to learn different things, to learn more, to
Mm.
know about many different things. Actually speaking, we should keep ourselves engaged in the right mode. That's
Yeah.
all.
Right. I hope this whole thing helps people. If there are any questions, any more questions, Rima ji, Jaya ji, any more questions, Vandana ji? I'm sure all of us are going through similar or kind of concerns now. Uh, the people here. So we all go through this, there is so much of information, Aramya, all around about, taking nuts, taking medicines, the self-medication. We in India, the drug abuse is highest.
Yes.
So, it's very
Not only the drug, I
concerning.
would say nutritional supplements are also on the highest.
On the high, yes. I'm so scared of all those things, like how people are popping up pills just like that, and even without realizing whether they need magnesium or calcium or for that matter,
Exactly.
anything. So it's a serious matter. So I really hope this whole menopause, the mindful menopause, I think it was helpful, and I'm sure
Thank
it's
you.
going live stream, and I'm going to share it, and please, you all do share with your well wishers and your friends and your family, and someone will definitely appreciate, because
Thank
this is
you.
really useful. Thank you, Aramya. Thank you so much
Thank you,
again.
Aparna, for taking this topic. I understand that it is.
Thank
Thank
you,
you,
Vandana.
Vandana ji.
Yes,
So,
and we are going to come again with some more important facts through Ayurvedic lenses. And till then, just
we
hang
will
on.
work it out.